Well, our esteemed viewers, welcome back to our Ani Media channel. My name is Titus Akolo. Remember, we've got a program that is Powerline show that we're going to discuss various aspects or various things concerning education, as well as KLU, academics, business, and many more. So today, we are discussing Kenya's new public health insurance system, the Social Health Authority, otherwise known as SHA. It replaced NHIF and promised affordable health care for all. But reports now show hospitals struggling with the delayed payments. Patients being asked to pay cash despite having cover, and billions of shillings in suspicious claims passing through the system. So today, we are asking a simple question. Is SHA working for ordinary Kenyans? And who is responsible when it doesn't? Joining us is Aldrich Chebai, an MCA aspirant for Kimilili, to help us break this down. Welcome, Bwana MCA.
Thank you, Bwana Titus. Yes.
So, Mheshimiwa.
Yes, Bwana Titus.
For viewers hearing this for the first time, yes, what is Social Health Authority meant to do, and why did the government replace NHIF with it?
Thank you. Social Health Authority, or SHIF, Social Health Insurance Fund, is a medical scheme that was intended to benefit all Kenyans universally, commonly known as universal health care. It was meant for common citizens, private citizens, and everyone who is a Kenyan citizen to benefit freely on matters medical cover and matters relating to health. Okay. 2022, as we were heading to the elections, we were told, or we were informed by our current president, then deputy president, that when he takes over office in less than 100 days, he will have replaced the NHIF with a new scheme called SHA. We were very opportunistic that it will work, but unfortunately, up to date, it does not yet worked as intended. As I knew, SHA was meant to benefit common citizens. At a low cost, citizens would have been paying a monthly fee or an annual fee basing on the rate of income of different people. For my case, I was given monthly rate of 900 shillings. There were some people given 1,000, okay. There were some people given 500, and there were some people who were supposed to be paying 300 shillings. Those are the low income individuals. But it's unfortunate that that is not the case. The system has failed. The workers, the employees, medical staffs and non-medical staffs in hospitals do not know what is working and what is not working. Okay. But for our case as citizens, we are still hopeful that SHA will work one day. Okay, yes.
So there are reports that hospitals are telling patients to pay cash because SHA reimbursements are delayed. Yeah, you know that, right? Yes. Why is this happening under a system meant to offer free, affordable care?
The biggest problem that our country faces is incompetence. People are given jobs, some people are given ministries, yet they are incompetent. Some are given opportunities like, for example, our president told us that he used 104 billion shillings to purchase and to come up with a new model called SHA that will be used to replace NHIF. It was a very expensive model, but up to now, citizens are not getting services as required. For example, in the year 2021, after I did my undergraduate program, I undertook my attachment at Kimilili Sub-County Hospital as a procurement of SAM or the internship. Okay, I got the opportunity to have first-hand information around matters relating to health. Then citizens used to pay cash 130 shillings in our hospital for the consultation, 100 shillings for laboratory, and probably 100 or 200 shillings for medication. Then came a new model, SHA, which was supposed, for example, an individual like you, Tetas, yes, probably you're supposed to pay 300 shillings or 500 shillings a month here, and when you go to the hospital, all bills are covered, regardless of the situation, the cost of medication, all the bills are supposed to be covered, and that 500 shillings. But that is not the case. For now, citizens, when they're going to the hospital, yes, you are told to pay SHA for 6 months. That's the first requirement, 4 to 6 months. But after paying that money, we don't see the results. Patients are still asked to pay cash, which is very unfortunate, very frustrating, and in most cases, patients die with the frustration that SHA is not working. Okay, yes.
All right. You just talk about when you start the registration, you pay, you're supposed at least to get the first 6 months payment before you access the services. Don't you think the duration is so long? Because assuming that somebody falls sick before the 6 months and the person has got to be referred at least the first 3 months, do you think it's important to reconsider the period so that at least like 1 month after contribution or 2 months, that's much better than waiting for 6 months?
That's true. Most of us youths, Gen Zs, we are learned, we are competent, we have information. But the individuals who are working for the government, the minister, the cabinet secretary, the permanent secretary, the directors, and all other people, most of them are clueless. They don't have real information. They don't know what is going on the ground. And above all, I think they care less about wananchi. As our president told us, SHA will be free. In fact, he said we'll be paying 300 shillings per month for a year, and those individuals who cannot pay 300 shillings the government will be paying for them, okay, on a yearly basis. It would have been fair if the government, through its ministry, would have done a research basing on facts, basing on what wananchi are going through, so that at least instead of paying for 6 months, you can pay for 1 month, you can pay for 2 months, or at least 3 months and to get services. Yes. Now, we were told that NHIF was not working well and it was replaced by SHA. But SHA itself is not working as well.
In fact, it's like we came from the frying pan to the direct fire.
That's the correct language. It's better than NHIF was a bit better, according to me, according to most citizens, okay? Because even if you didn't pay for 6 months, but you just paid for 1 month, when you treated the assisted less.
Okay. Recently, government officials revealed that about 1 billion, and I repeat, 1 billion, 11 billion Kenya shillings in suspicious claims passed through the SHA system.
Yes.
Could you please explain in simple terms what that means?
In simple terms, that is theft of the highest order, because there's no way a system costing 104 billion cannot be accountable and cannot be dispersing money to the hospitals, but still lose 11 billion in a short period. That means that the president, the cabinet secretary, and all government officials related to Ministry of Health have failed in their duties because 11 billion is quite a lot of money. Currently, hospitals don't have medicine. Some hospitals, for example, we recently heard that St. Mary's Hospital Mears was closed because of SHA owed the hospital around 100 million or 80 million. But instead of paying hospitals their due money, government officials think it is wise to stay the money instead of giving the money to the hospitals. 11 billion is quite a lot of money, and if we were the system of Kenya could have been working, those individuals would have resigned, and a judicial process or a law process would have started to find out how the money got lost, who was involved, where was the money taken to, and why is the system failing. This.
Okay, so in short, you think there is a weakness, a serious weakness in the system, so whereby that money gets lost just like that, and someone cannot actually explain how it goes like that. Yes. Okay. Now, what does all this mean for an ordinary patient who goes to hospital expecting SHA to cover him or her? You get it? You're expecting SHA to cover him or her for their treatment, and then they're asked to pay cash.
To the common mwananchi, this means that they will not be able to get medication, they will not be able to be treated, hospitals will not get money, and that means that wananchi would be forced to use their money from their pockets to pay for the bills, the hospital bills.
Okay.
Yes.
Now, talking about hospitals not getting money because of either delayed reimbursement. Now, who should be held accountable when hospitals lack medicine or turn patients away because SHA hasn't paid them? Who should be solely held accountable?
The person who should be held accountable according to our institutions and the way Kenya is in structures of Kenya runs is the Cabinet Secretary for Health, the Permanent Secretary, and all senior officials in the Department of Health or the Ministry of Health should be held accountable in each and every coin that get lost.
Okay.
Yes.
As someone seeking public office, what clear step will you take to protect patients and hospitals from these failures?
Yes. In the first place, Titus,
Yes.
healthcare is devolved. That means the county assembly, I, as an aspiring MCA, will be responsible in making laws relating to healthcare institutions and some few things on the local side. That means if I get the opportunity to be an MCA of Kimilili 2027, I will go to the county assembly of Bungoma, make laws, create laws, change laws so that common citizens can benefit 100% from the healthcare institutions. Okay. Yes. For example, SHA is a national project. An MCA cannot be able to legislate about SHA, but we can make noise or we can create avenues that our MPs can use so that they can go and legislate and represent our issues at the National Assembly, because it is their sole mandate to represent issues of wananchi at the National Assembly.
Okay.
Yes.
That's correct. Just another question. I am not an MC, I'm not a politician.
Yes.
But I was just wondering, when you get sick as an MCA, would you prefer going to your home, that is Kimilili Sub-County Hospital, for treatment, or you would rather go to India?
I prefer going to Kimilili Sub-County Hospital because I will get elected by wananchi of Kimilili, and I need to know if the systems at Kimilili Sub-County Hospital are working, and if they're not working, it will be my sole responsibility to go and make laws and ensure that hospitals work. For example, in our hospitals that are managed by the medical superintendent, we have the hospital administrator and different heads of department at the hospital. I will ensure that each department works according to the way it's supposed to work, because as a procurement professional, I understand the process of procurement. One, medicines in hospitals are not brought at night, okay? There's a process. The user department, for example, let's take maternity. Maternity has the head of maternity department. Okay. He or she is supposed to make a list of the requirements that the department needs. Okay. Whether it's medicines, whether they are non-pharmaceuticals like gloves, cotton, spirit, and any other thing, and submit those requirements to the procurement department. Then the procurement department is supposed to tender, to procure, to advertise a tender of the same, so that bidders can bid. The due process is followed, and we ensure that everything that is needed in the hospital is provided. We have in Kenya we have KEMSA. You have heard about KEMSA? Yes, definitely. KEMSA. And KEMSA is solely responsible for supplying medicines and major equipments to the hospitals. But we had the other year that someone just walks in the corridor of KEMSA, gets tenders, supplies hot air, and the hospitals don't get medicine, but money is lost. I will ensure that I, as a representative of the people, I will be treated in Kimilili Sub-County Hospital and ensure that my fellow Kimilili people or citizens get better services at our local hospitals.
Okay, thank you so much for the feedback. Yes. My dear viewers, you are watching Powerline Show on our channel, Media. Today, as I told you earlier, we are having our Mheshimiwa is elaborating and enlightening people about this giant thing called SHA. And I've got a last question for him. Yes. Mheshimiwa. Yes. We've got MPs, we've got governors, we've got senators. Yes. I was like thinking, and I just want you to give me an opinion. It's related to the last question I asked you. We should have maybe something like a constitution or a law that prohibits governors from seeking medical attention from other counties or even outside the country. You get that? Yes. Because why is he going or why is she going outside the country? That means in their county, there is something missing in the hospital of which they should have done. I'm sure if they do that, if they restrict them from going outside, they will make sure that the hospitals in their counties are well refurbished, are well facilitated, and everything is intact. What is your take on that?
My take on that is this.
Yes.
I think going forward, probably when we get a new government come 2027 days, God willing, we need to create laws and policies that work for people. You cannot get a governor. Is supposed, for example, in Bungoma County, you get an annual budget of 16 billion. Last year, financial year 2025-2026, this current financial year, Kimilili Hospital was given 200 million for medicine, non-pharmaceuticals, and everything related to the hospital. But the same day that money was given to the hospital, the next day, when you go to the hospital, you don't get the medicine, you don't get services. It will be fair if there is a law that prohibits lawmakers, MCAs, governors, senators from going outside the country.
Yep.
First, they should seek medication at the local hospitals. Then, if the condition is not managed there, they should be referred, for example, from Kimilili Sub-County Hospital to Bungoma Referral Hospital. And if Bungoma Referral Hospital cannot work, then probably be referred to a bigger national referral like Kenyatta National Hospital.
And why should them be referred to other big hospitals when they have the ability to make sure that their county has got every medical facility that it needs?
It's because most of our leaders are selfish, most of our leaders are incompetent, and above all, many of our leaders go there for their own benefit. They go there to just steal money from the institutions, build their own homes, take the money outside the country, yet our facilities are left crippled. It will be good if we will create laws. For example, if I get the opportunity to be an MC of Kimilili, we can go to our county assembly, create laws to ensure that all MCAs and everyone in the county assembly first gets medication and treatment from our local hospital.
Yes.
And if they feel they cannot get medication here because some facilities or some equipments are not there, it will be their sole mandate to ensure that those equipments are brought so that the next time they go to the hospital, they get the required treatment.
I'm even waiting and longing to see a governor going for treatment in a local dispensary. I think that would be a turning point for things in our hospitals. My dear viewers, with that, we are coming to the end of our segment, the Powerline Show. We've been discussing issues SHA, and I suppose you've got to know exactly what SHA means and why should patients not be turned away from hospitals. Actually, it's their right to be treated because they are contributing. There should be no excuse that the money has not been reimbursed. There should be no excuse that the medicine is not even in the hospital. I have been your host, Titus Akolo. Until next time, be blessed. But remember to subscribe to our channel.